Hi, I'm Cindy, and I'll be the host of today's podcast. Today's episode is focused on a healthcare role that many people have heard of, but very few truly understand: the medical office assistant, or MOA. At job fairs and information sessions, one of the most common questions we hear is, what exactly does an MOA do? So today we want to answer that clearly based on real clinical experience, not just job descriptions. We're joined by one of our medical instructors, Dr. Razgan, who has worked in real healthcare settings and has seen firsthand how MOA support patients, physicians, and the healthcare system as a whole. Thank you for joining us.
Thank you for inviting me here today. Hello, so I'm Dr. Raskin. I'm a dentist by profession, but I also do a lot of medical instruction. I like to do a lot of documentaries. So I do lead different small projects, leading documentaries on climate change and mental health. And I've been working in a lot of case management for communities, specifically vulnerable populations, and I'm also doing a lot of research in a dentistry itself. And I do like to advocate a lot for oral healthcare disparities. So I'm really happy to be part of this discussion. I have worked in a lot of healthcare settings, mostly dental healthcare settings, community settings, but many people think it's just a receptionist role. But in reality, medical office assistants or unit clerks, they are trained healthcare professionals who help clinics, hospitals, dental clinics, hospices, long term care centers uh, to function smoothly. So they are often the backbone of the system, front of the system. Even if patients don't always see what's happening behind the scenes, there's a lot that goes into the proper workflow or the functioning of the whole healthcare system.
So let's start with the most important question. In real life, what does an MOA actually do?
I would say in real clinical environments, and when I say clinical environments, it's not just the medical clinic. It can be any kind of healthcare setting or even a community setting. MOAs do much more than just answering the phones or booking appointments. They often are the first point of contact. Okay, the first person the patient's gonna meet, the doctor's gonna meet. So they play a key role in shaping that patient's experience. On a typical day, I would say an MOA may greet, check in patients, verify the health information, manage electronic medical records, scheduling appointments, preparing referrals, and communicate with the labs, pharmacies, specialists. They even do medical transcription. So the list is like a very long list of things that they do. And the most important is they also ensure that the documentation is accurate and complete, because even the small error or something that's missed or a communication error can be a big thing in a healthcare setting, especially when all the documentation is a legal documentation. So what many people or people who are not working in healthcare settings don't realize that this medical office assistant and health unit clerk program or health unit coordinator program prepares these graduates not just for working as a receptionist role, but it's more than just physician offices. As I was mentioning earlier, when they when they graduate, they have the skills to work as health unit coordinators, not just in medical offices or hospitals. It can be clinics, dental clinics, it can be long term care centers, rehabilitation services, diagnostic imaging clinics, and even recreation or community health facilities. This is all where their communication, their medical documentation process, and the skills, the coordination is required. And I have seen firsthand that some of my own graduates have moved into medical transcription, where they use their knowledge of medical terminology and documentation standards to accurately transcribe the medical records or physician reports. So this role is both clinical and administrative. It's very versatile. It just really depends upon the skills that they obtain from the program, what they actually kind of like doing at the end of the day they graduate, and then they kind of go explore their options.
Mhm. Okay. So, from a medical professional's experience, how important is an MOA's role in a patient's experience?
I think it's extremely important. I had a meeting last week with Ministry of Health of Ontario, and they kind of explained the same thing that if you really want to improve a healthcare workflow in a healthcare setting, you really have to start from the medical office assistants, the reception people, people who are working at the very front talking to patients because they are the front, they know what's happening around. Patients may only spend a very short time with physician, with a dentist, with a health, with a surgeon or attending physician, whatever that may be, but they interact with MOAs throughout the visit, from booking an appointment to checking out. So a skilled medical office assistant or a skilled health unit coordinator, they help the patient feel heard and respected. They reduce the stress by explaining the next steps clearly, ensuring the referrals are processed properly, and making sure that the follow ups are scheduled correctly. I also feel that a lot of errors and things that can go wrong are prevented actually at the very front at the beginning because of the medical office assistants. In the States, in the United States, and some of the provinces in Canada, you'll see that the medical office assistants, they do a lot of clinical work as well in terms of taking vital signs measurements, um, taking a lot of notes for the physician. Again, we don't have a lot of physician assistant specifically, but they do that work as well. So again, how much clinically they want to be involved really depends. When they are more experienced working as in the admin in the front, they can move into clinical role too. But what I see is that no matter their role is clinical or more administrative, it directly impacts the quality and safety of the patient care.
So, to help listeners better visualize the role, can you walk us through a typical day in the life of an MOA?
Yeah. So I would say they come in when the patient's arriving, the MOA verifies their information. And this is what a patient would see. But at the very beginning, and this is what I teach in the program a lot as well, that it's really important that an MOA knows about the workflow. So very beginning in the morning, the MOA prepares the patient charts. They're going to prepare the schedule. They're going to review the lab results that may have come in overnight. They will be checking the messages from patients, specialists, voicemails. So they're going to be doing a lot more than even the patient would know. Okay. And then once the patients start arriving, the MOA is going to verify the information. They're going to confirm the insurance, health coverage. And that's quite tricky most of the times, ensuring the consent forms are complete throughout the day, throughout the whole day or night, depending upon where they're working. They may assist with the documentation, process referrals, coordinating the follow-up appointments, and answer any patient questions. However, in hospital settings, it can look different. Most of the times when they are working as hospital unit clerks or health unit coordinators, they may be involved in more clinical side of the work, like processing the physician orders, documenting the SOAP notes, communicating with different departments, arranging patient transfers, updating the electronic health record system again, and also triaging. Again, they cannot just move into triaging after they are done with the program, but they do take some training and then they can move into triaging as well. So at the end of the day, I think from very beginning A to Z, I would say they organize the documentation, work a lot on the record, electronic medical records, reconcile the billing. That's how the clinic gets paid, right? So that's really important. And the very most important is preparing for the next day as well. And this is how the flow is maintained properly. So it's very structured. Environment can be very busy, can be very structured. So what we teach in the program is about those skills and how to really use the skills in the real life scenario. So strong organization, multitasking, communication skills, along with that medical terminology and the skills they need to be a better MOA.
Right. So, what are some common misconceptions people have about MOA work?
A very big one that I can think of is that MOAs don't require formal training. In reality, what I think is, be it medical office assistants or hospital unit clerks or health unit coordinators, they do need to understand medical terminology, the legislation, the privacy legislation, the confidentiality rules. Like in Alberta, we use Health Information Act. What all is included? What's part of it? Professional communication standards, depending upon the province or the country they're in. Electronic medical record systems and healthcare workflows. In Alberta, for example, as I was mentioning, we are bound under the Health Information Act. So understanding the confidentiality and documentation accuracy is very critical. So someone who is not provided this training might have good communication skills, organization skills, and they can start working in a medical office or a clinic, but they are bound at a point making a very big error or mistake because they're not aware of those standards, those policies, especially those confidentiality and legal aspect of this job, and that's very critical. Another misconception is that, oh, it's a very easy job, it's a simple job, but what I feel is it's both physically and mentally demanding. So it requires a lot of mental focus, it requires emotional intelligence, and our program itself, a major component is the attributes, the personal attributes. Yeah, so the student gets to learn a lot about emotional intelligence, strong organizational skills, not just the basic ones, but how it's specific to a healthcare setting. So what I see is MOAs or health unit coordinators, they deal with a lot of confidential information. They deal with difficult patients, they deal with anxious patients, they deal with time sensitive documentation, all happening at once. So, how do they make sure that they are meeting the scope of the job is what we teach. So, I think the program, the Medical Officer and Health Unit Coordinator program, provides this structured training so that graduates are prepared to handle these responsibilities professionally in the real scenario.
So, why do you believe healthcare and roles like MOA have such a strong future?
Healthcare is one of the most stable industries because people will always need care, regardless of the economic conditions. And especially in Canada, we are seeing an aging population, right? An increased demand for medical services. Clinics are expanding, long term care centers are growing, hospitals continue to rely heavily on administrative healthcare professionals. And with that, I mean medical office assistants, health unit clerks, health unit coordinators, medical transcriptionists, physician assistants, and the list continues to grow. MOAs are essential because they keep operations organized. Again, there is so much when I say the word operations. Uh, Without trained MOAs and health unit clerks or health unit coordinators, physicians and nurses, dentists even, would struggle to manage the documentation, would struggle with scheduling and the communication efficiently. And because these skills that I'm talking about are transferable, MOAs can move between different healthcare settings. I work in a dental clinic, so I see how in my previous dental clinic and experience, there were actually admin people who did MOA program. So it's not like that if they do an MOA program, they are sticked to, or they can only use the skills in a medical clinic. So from medical clinics to dental offices to long-term care centers to rehabilitation facilities to community health programs to community health centers, the flexibility adds to the long-term career stability. That's how I see it.
So, for someone new to the healthcare or considering a career change, why is MOA a good starting point?
I would say MOA is an excellent entry level healthcare career for several reasons, and this is something I keep on repeating in my class as well. First, the training period is shorter compared to any or many other healthcare programs, which allows the graduates to enter the workforce more quickly. Second, it provides the real exposure to the clinical environment. Students learn how healthcare systems operate from inside. Most importantly, this program opens multiple doors. Graduates can work in physician offices, to clinics, to specialist practices, to even recreation facilities, as I mentioned. Some choose to work in medical transcription. Using their medical terminology and documentation skills, they can be good as a transcriptionist. Others move into office management or healthcare administration. Some even go for clinic managerial jobs if they're good at leadership. So, what I see is it's a way to enter into a place where you have an exposure of, or bits of exposures of everything. And then you kind of work into it and you see, okay, which one I might be the best at, and then explore that option. So, it's not a limiting career. I see it's a foundation that can lead to many different paths.
Right. So, what advice would you give someone considering becoming an MOA?
I would say be prepared to learn continuously and take the role seriously. Healthcare profession requires professionalism, it requires empathy and attention to detail. If you enjoy organization, if you enjoy communication, and you want to be part of meaningful work that supports patient care, this can be a very rewarding career. Also value your practicum and hands-on experience. The real-world exposure builds confidence and makes you job ready. The MOA Health Unit Coordinator program doesn't just prepare you for one job, it prepares you for a healthcare career with options and growth. It just really depends how much you explore, take it all in, and then provide value to the society.
Well, thank you for sharing your experience and insights. We hope today's episode helped clarify what MOAs really do and why healthcare providers are so important. Thank you for listening, and we'll see you in the next episode.